Srimati Supriya Sule.
Thank you, sir. I stand here on behalf of my party to speak on the Indian Medical Council Amendment Ordinance. The Honorable Health Minister, who has, in his tenure, has made a lot of very, very good interventions, starting from immunization programs to making sure public health reaches the common man. But I think the biggest challenge, I represent those thousands of parents who went, especially the state where I come from, who were completely devastated because today an average Indian who aspires, dreams big for himself, what he misses out, he wants to live through his children. It's a time and ages of aspirational India. And I think that's the hope these parents came from, whether it's an IIT, whether it's an IIM, or all the competitive exams. All these parents aspire to send their children to give them a better quality of life and a better quality of opportunity through education. And I think the NEET exam came as a shock to most of the parents. And that's when we had agitations in our state. We reached out to the Higher Secondary Education Minister in Maharashtra, who reached out to you in turn. And we had some relief by pushing this exam ahead. Now, if you look at the entire picture, sir, do we really need this exam? Like what even sir from the chair said, that what is the logic behind taking it? We are not against it at all. I am completely agreeable to you if you can have one common exam. But the impression that the parents get and the teachers get, the perception about this exam that is very pro-urban and it's very pro-CBSE exams because the curriculums are completely different. In our state, we have 3 boards. We have the ICSE board, the CBSE board, and the state board. About 90% children in our state go to the state board. About 5 to 6% go to ICSE board. And now, yes, CBSE is growing, but it's mostly used by professionals or people whose jobs constantly make them move, or the Kendriya Vidyalayas as an option, but it's very, very hard to get a seat there today, sir. So given this background, what really do you have in mind? I think most of my seniors have talked about it earlier, but I think the biggest challenge today, my colleague Dr. Dastikar extensively talked about all the issues. She herself is a doctor and her 2 sons are also doctors. I know what difficulties she has gone through to put her children through this education all the way because 2 of her boys today study in my state in a private college. So as a parent, the difficulties that she has seen, I have seen, sir, very closely. The cost of making your son or a daughter a doctor today is about 15 lakhs, which is impossible for an average parent. And like what Dushyant said is absolutely true. If he goes to a private college, you have to book the seats at least 2 years ahead. I remember Kakoli was running around like a headless chicken for over 2 years to make sure her sons get the right marks, get the right coaching, make sure they get into a right college to do their masters. So this whole disparity of having a good doctor, and what it is today's doctors, like everybody else, the sense of the entire house is that is no more a noble cause. A doctor, a lawyer in the good old days were the thinkers of a village or a city. They were not businessmen. Today, unfortunately, this entire being a doctor has lost its sheen because clinical diagnosis no more matters in this country. With all these new innovation, new technologies, even the government, even the previous government or this government, you all have wonderful machines even put in rural India. But what is the outcome? Do we have the technicians for it? So most of our constituencies have all these facilities, but we have the facilities, but we don't have the manpower for it. So it's whether the chicken or the egg. So what are we really going to address? So this NEET exam is a wonderful intervention, but I would really appreciate if you consult the states, because it is a concurrent subject. It's not something nobody has said before. And given this background, if we really want more doctors, are you willing to take away or provide for seats for every child from the private education? I mean, private education in this entire debate has looked at very badly. But today, whether we like it or not, most people who sit here, all our children go to private schools. We are not sending our children to Jilla Parishad and government schools because the faith that is in basic education, for primary education, unfortunately in this country, we believe that it's a private school, it's a better school. So how are you going to look at this disparity? I'm not promoting any private college, but today there are a lot of very, very good colleges. I mean, if you talk about colleges in Vellore. That was the first private college, sir, started when there was even no medical interventions. And the Vellore Medical College, which is a private college, is a very, very good college. The Manipal College is very good. One of our colleagues in Rajya Sabha runs a wonderful college, even in Belgaum. As a matter of fact, he's a part of your team, sir, an elected member who runs a wonderful college with very minimal capitation. But how do we cover both? I mean, why can't we have an open discussion on how their costs can come down, so you have some way of monitoring that, or how come government seats? Today, I know people who at 99% cannot get into KEM college. I mean, besides 99%, there's only 1 mark that you've lost. So how are we going to address this issue? And I think it's not only about the entrance exam. What looking for the Honorable Health Minister is looking for a larger solution of finding good doctors, go back to the old school of thought where we all had family doctors. There's no concept of family doctors. Even if I want to answer, I cannot get a family doctor in this country anymore. Even an MBBS doctors are not trusted. And by the time these masters, I mean, look at Kakoli's children, till they're 29, they're not even settled. While if you do a business management program today, the boy is working on Wall Street or any foreign degree, by 24 he's earning and even buying apartments for himself. So it's a very difficult and a high cost job. So I urge this government to address this issue of how we can have more doctors. The entrance exam is not the only challenge ahead of you. It's to make sure that how we can bring this disparity between private and this together. We support it, but I still urge you, please have faith in the states. The state boards cannot cope with CBSE, and no rural child today will be able to become a doctor in this country if this goes on. So please do rethink what you are. We are with you. Everything must go on merit, but every child deserves an opportunity. Thank you, sir.